You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you've been diagnosed with low thyroid or if you think you have a thyroid condition. My first guest is Dr. Hinley. Dr. Hinley, welcome to the program.
Thanks, Randy. It's great to be here.
All right, now before we get into today's topic, your center, I guess you do more than just thyroid, but today we're talking about thyroid.
Right.
Tell me a little bit about your practice.
Well, the Chicago program really specializes in three things only. Our primary focus is type 2 diabetes. We also look at peripheral neuropathies, and then hypothyroidism, of course. So these are solely what the clinicians, and we have physicians of all different backgrounds that work there, and we work to...
So you have a medical doctor there and...
Correct.
Kind of a team.
Allied health professionals, yeah, we have a lot of people there, correct.
So you've been in and around, we've talked around prevention, longevity, health for about 22 years.
Exactly. 22 years, we've taken care of everybody from infants to world-class and professional athletes all the way up to, patients that are also struggling with their health with obviously these three issues as well.
So now your center, though, is in Chicago. We're in Chicago.
Yes, Oak Brook. So it's by a large shopping mall, well-known shopping mall.
Well, okay. Now let's begin though with thyroid. Okay. Who's the typical patient that comes in for thyroid on your thyroid program?
A typical thyroid patient is somebody who's frustrated. They've been diagnosed for many years prior. They've had their lab work. They understand what their readings are, and a lot of these patients have lab work that's actually within normal limits. The frustrating component for them though is that they don't feel normal at all. These are patients that have symptoms that are literally ruining their lives. Most of our patients with thyroid conditions are between age 30 and 55. These are young mothers. They have families to take care of. They have spouses that they need to interact with. And the problem is they feel terrible. They feel miserable.
Now, so I get this correct, or right, that you don't give thyroid. These are for people that have already been diagnosed with a thyroid problem, but their thyroid medication is not working.
They're already on thyroid medication.
Do I have that right?
Well, the thyroid medication makes up for what the thyroid gland doesn't produce by itself.
Okay.
So the thyroid, produces two thyroid hormones, T3 and T4, and those are necessary for metabolism and a lot of things that are extremely important to the body to function. So these are patients that are on that already, but unfortunately, they have symptoms that continue to get worse, and that's the frustrating part.
Okay, let's start there. What are symptoms of low thyroid?
Well, fatigue and weight gain. So, weight gain, these are patients that don't improve or take more calories in per day, and they just continue to get larger.
Just can't lose weight the way they used to?
Right. They can't break a sweat when they're working out. They're gaining usually 20 to 30 pounds in 6 months or so. That should be a red flag that something's going on with the thyroid gland.
Okay.
We also have fatigue problems. These are young women typically with young families, children, and they don't have time or energy to shop. They don't have time to prepare meals, let alone work out, even if they had the energy.
So they're just exhausted all the time? Is that what they tell you? I mean, when they come into the center, they say, I'm just tired.
They do. And some of them are executives that can't work anymore. They're losing their job. There's guilt related to them not really being able to perform at work. And it's a huge issue for the entire family when the thyroid's not working.
Fatigue and weight gain. And let's talk, okay, so the thyroid, I guess, is in your neck.
Front of the neck, right? 2 lobes. And that gland is responsible for energy production. It also
and body temperature, right?
Right. It regulates body temperature. So these are patients that get cold in a room when the temperature in the room is, comfortable for everybody else in the room. So
now, okay, so people have like cold hands, cold feet.
They do. Circulation problems are part of it.
Thyroid?
Can't sleep well.
Do you go around diagnosing all your friends and family low thyroid?
I do. Actually, I have family members that have that going on. Right. And that's one of the things that prompted, and there are patients in the Chicago program. I have family members that are patients.
Interesting.
Amazing results, too.
So for a working definition today, low thyroid, hypothyroidism, same thing.
Correct.
Is that right?
A little easier to understand. Low thyroid's more of a correct term for that.
So weight gain. All of a sudden, you can't lose weight the way you used to. Might be thyroid. Might be a thyroid condition.
Correct.
And we talk about tired all the time.
Yes.
Cold, hands, feet.
Cold, circulation problems.
When everybody else isn't cold.
Exactly. That's one of the main ones. There's really constipation. There's digestive issues that take place. They don't produce enough acid in their stomach to digest
So constipation.
Food. Constipation, right. Interferes with their sleep. They have joint pain, muscle aches. These are patients that, again, the brain fog is a big one for them.
Brain fog?
Yeah, these are patients that create a list and they'll put 5 things down on a list. One day they'll get 3 done. The next day, unfortunately, they're struggling just getting out of bed and making the bed behind them. So this is something that creates...
I had, one of your partners, one of your associates, I had Dr. Carter on the show, and she says, Randy, when you see these people carrying a list for every single possible thing that they do, if they don't have that, and they confide in you guys, that they will forget everything.
It's extremely difficult.
Is that true? Is that right? I mean, do you see that?
You and I can remember a few things that we have to accomplish during the day. These are our patients with the, sticky pads. They have to constantly bring it with them. And look, it must be, it's an amazingly frustrating condition to have.
So thyroid is connection. And of course, when you guys go there, there's some people that want to know the science. I'm not going to ask you about that today, but there's science behind what you're saying is written in the literature. The experts agree that thyroid could have a connection with things.
Absolutely.
Like constipation, because constipation's big.
Right.
Other things you say, hair loss, headaches.
There's physical manifestations, and those would be the things that we see, like the hair getting brittle and falling out. So these are women that see it in the bottom of the shower, when they brush their hair. The skin gets very coarse, needs moisturizing a lot. So the other things we see is, the outside third of the eyebrows thin many times.
The outside of the eyebrows.
Exactly. This is one of the things that we see in the patients that come in.
Really?
So the physical things about their bodies is one of the, women, again, in the 30 to 55 age group, when they're seeing their hair thinning and falling out and they're seeing weight gain for no reason, usually these are the triggers that allow them to come in and get checked.
Your program, this Chicago thyroid program,
yes.
People that are currently taking thyroid, but it's not working. That means their blood work, they tell their doctor.
Correct.
I mean, explain that.
The most frustrating office visit a thyroid patient can have is, we have patients that have been on thyroid replacement hormone for literally, 20 years of their life. And these are patients that still struggle with these symptoms we just talked about getting worse in their life. I think the most frustrating visit that they have is when they go back to their doctor and they look at their levels and they're told the thyroid stimulating hormone, which is an indicator of how well the thyroid's creating the hormone that it needs to, is within normal limits. In fact,
so they tell the patient they're fine.
Yeah, we had a patient recently who, the last straw before she came in to see us was she said, you need to be on antidepressants. And this patient came into us and said, I'm not depressed, I just feel terrible. So, again, frustrated to the point where they need to look past just this one indicator in the blood system. And really, that's what we pride ourselves.
Okay, so they're taking a thyroid oral medication.
They are.
Okay, so that raises this blood work that...
Right. The TSH level actually lowers as they take the medication, and it falls into a normal range.
Falls in a normal range.
Right. The problem, though...
So that gives like a false
sense of security, false positive that everything is fine. But thyroid patients know that they're not fine. They're getting sicker and they're feeling worse. So
what's the answer then?
The answer is to look past the one thing, the TSH level, and dig deeper. See, 90% of the thyroid patients in America, and literature supports this.
Are you sure? I mean, in America?
Yes, in America.
Okay.
So overseas, we talk about having a diminished iodine level. In America, we know that it's something called Hashimoto's syndrome or Hashimoto's disease. This is actually an autoimmune disease. So autoimmune diseases attack the thyroid gland, and that's the reason why the thyroid doesn't make the hormone that it needs to.
So 90% of the people have Hashimoto's disease?
Correct. Well, in our practice, between 80 and 90% come in with that, and they have not been diagnosed with it. So again, you need to look past just the TSH levels and look at what's attacking the thyroid gland itself.
So let's talk about Hashimoto's for a second, because I mean, I Googled it this morning, and it's almost like the same symptom. I mean, it's different. Explain what it is.
Well, it's an autoimmune disease.
Thyroid.
So it falls into a group of autoimmune diseases. So autoimmune diseases, everything from rheumatoid arthritis to multiple sclerosis to scleroderma, lupus. These are things that attack the body. Is attacking, its immune system is attacking things in the body. And your thyroid gland happens to be one of those things with Hashimoto's disease.
So with Hashimoto's disease, is there like a blood work or a biological marker where they say, okay, you have something attacking your thyroid?
There is. And there's the TPO test, which is the thyroid peroxidase test. The antibodies are looked at because antibodies show that there is an attack, an army sent out in your bloodstream to attack a particular tissue.
So the thyroid is sending out antibodies?
No, the body is sending out antibodies to attack the thyroid, right?
Oh, I got you. Okay.
The follicles in the thyroid gland actually get destroyed to the point where it cannot make natural thyroid anymore. The T3 and T4 is not produced. So we take the synthetic hormone, brings the TSH level down, and the problem, though, is the patient doesn't feel any better.
Interesting. Okay, so your patients are currently taking thyroid, and the underlying cause might be this...
Hashimoto's, right.
Hashimoto's.
And many of them have been diagnosed already with Hashimoto's disease, and those are the patients that, can get the best results in the office.
Now, I look, and I have a lot of questions about that, but, I was going down this list of symptoms, and then I interrupted you, but decreased libido is affected, irritability, depression.
Right. Depression's a huge one. I mean, depression... Because the brain's not working properly, thyroid gland, these hormones are very important with how the brain functions. But also these are patients in their lifestyle. Again, think of the woman who's laying at home after a hard day's work. Number one, she's feeling guilty. She's feeling guilty because she couldn't remember things at work. She's not living up to her performance level at her job. And then she gets home and literally there's no energy to spend with the children.
And this is what they tell you. I mean, they come in and
day after day
and describe this.
They do.
And it's turned around. I know I keep repeating myself, but that when you identify this underlying cause.
Identify the triggers. So find out for that particular person what the triggers are. And then the job is to suppress or decrease the amount of autoimmune flare-ups. So the antibodies, the army against the thyroid, we can actually shut down, and that's how patients get better.
So when, going down this list though, muscle cramps, carpal tunnel syndrome,
right,
all connected with
the autoimmune,
Hashimoto's.
Exactly. Autoimmune disease. Remember, Randy, it's the immune system that we're talking about. The immune system, it handles everything in the body. So your body cannot fight, it cannot heal if that immune system is not 100%. So that's exactly what we work toward in the clinic, is to change that around. And this is how we get the results that we get.
Okay, so let's begin with your approach. Okay, I mean, you do a lot of things. You feel it's a very comprehensive, one of the most comprehensive thyroid programs.
Exactly, it is.
Available?
Yes.
Okay.
So, absolutely, it starts off with taking a proper history. So again, the doctors are going to spend time with you. The doctors are trained to look at, the clinicians, they're trained to look at genetic, environmental, lifestyle issues that could be affecting you specifically. So once we understand those things and we can find out whether you're a candidate for the program, Hashimoto's, if they've prior been diagnosed with that, these are patients that can start right away.
We should mention, by the way, because you guys offer a free consultation, because not everybody's a candidate.
We do, correct.
Right? So they go in. And what's that about? I mean, what's that initial consultation?
We look at it like doctor means teacher. So first and foremost, the families come in, and again, it's a family affair because everybody's being affected.
Interesting.
So we educate them first and foremost all together about really what they've been through, the physiology of the condition, and what you can expect as far as.
What do you mean by everybody's affected in the family?
Well, again, these are women between age 30 and 50. So these are the patients that have young children. Randy, when we get people well, the most amazing thing in the clinic is that we get letters from patients saying, "Thank you so much for giving me my wife back." They talk about, husbands.
Really?
Yeah, they say, "My children are young, and I know they can't tell you, doctor, but, thank you for giving our kids their mother back." I mean, it's amazing the changes that we see on a daily basis.
So you got kind of a moody, miserable, lethargic person in the family.
Hasn't slept, absolutely at their wit's end, can't cope with daily stress. Their job, if they're working outside the home, is putting pressure on them to perform. And again, they're dealing with mental issues where they can't focus. There's no memory. So they're underperforming, feeling guilty, and then the guilt just adds when they come home. There's no interaction with the family. And, we have a patient that say, if she knew she was going to feel like this, it's just not worth living. Literally 8 weeks into our program, she's going out with her husband, going to concerts till all hours of the night. And, she's back living her life. She actually feels like she's comfortable in her skin again. That's what she told us 8 weeks in. So it is a family affair, and it starts with the educational process.
Okay, so you go over the program. And it's like a 4-month program, it's a 6-month program.
Exactly. And it all depends. It's individualized. It all depends what we're up against. Some of these patients have been diagnosed for 20 years. Some of them are newly diagnosed. We have a 19-year-old just came in she was diagnosed with Hashimoto's when she was 18. Her mother brought her in for this consultation, and she was at her wit's end. Think about having a 19-year-old and you're at your wit's end already. She was struggling with migraine headaches every day. She had a bad case of acne. These are patients that, the main concern of her mother was she was not focusing enough to get through her classes in college. So she was not going to graduate necessarily. So they came in 8 weeks into the program. Actually, 4 weeks, her acne completely cleared up.
The acne
cleared up.
Interesting.
Right. She's able to get a job. She got fired because she couldn't focus and produce at her last job, and she's going to graduate on time. It's amazing to see what happens in a very short period of time.
And so these people had this immune problem, autoimmune problem,
they do.
Hashimoto's disease. And
correct.
People could Google that.
Absolutely.
And so the science is there. And so you guys you like to say you're going to the underlying cause. You're not just treating the thyroid.
Correct.
You're treating what's driving the thyroid down.
Correct.
Is that
exactly.
right?
What's attacking the thyroid can be suppressed. The Hashimoto's, the autoimmune flare-ups can be put into remission. That's our job. That's the clinician's job, is to get to that point. Suppress it, put it in remission, and then the symptoms go away.
And this is integrative medicine? I mean, is this what you call it?
Yeah, it's integrative health.
Integrating the best of what? Traditional medicine and
absolutely
what some people might call alternative medicine?
Maybe not so much alternative, although if you're talking about, fundamental, the medical model as far as having good solid nutrition, targeted supplementation.
Okay.
If you're calling that alternative, then I guess it's alternative.
Okay.
But it's more integrative. Again, we have physicians of all different backgrounds working together on the patient to make sure that they get the best outcomes.
Have you had patients that, I think we talked on the phone, I'm not sure if it was you, it might have been one of your associates, but that people that have gone to major university clinics
right,
without results have gone to you?
Absolutely.
Is that right?
That's correct. Yeah, we see patients from all over. In fact, now, interestingly enough, with Skyping and things like that, we have patients that aren't even in the state that we consult with, and we can still do what we need to do. I wouldn't recommend that because our clinicians spend detailed time with every patient. It's about a 30-minute interaction every time. It's not like going to your doctor and checking a TSH level every 3 months and spending about 10 minutes. They're going to sink the time in to do whatever they can that's necessary to get the patient well.
Okay,
and we pride ourselves on that.
Once you determine that the patient is a candidate for the Chicago thyroid program,
yes,
then it begins with testing.
It does.
And you guys are pretty heavy into testing.
Yeah, extensive lab testing. Again,
we have to example.
Well, we have to identify the triggers. So remember, the triggers of this condition can be hormonal. So this is high testosterone levels, like polycystic ovarian syndrome. These are things that can absolutely play a role in the thyroid not producing what it needs to. Hashimoto's, in fact, is triggered many times after a patient has a baby. So, the estrogen surge is one of the triggers as well. On the other hand, we have insulin surges. We have, heavy metal toxicity. There's adrenal suppression going on. There's not enough vitamin D. Some of these patients hear that taking iodine would correct their problem, as we talked about earlier. That's just in underdeveloped countries. We don't really worry about that. But they take iodine, and it actually makes it worse.
Really? Okay, so you're doing hormone panels. You're looking at their hormones.
The lab work, the hormone panels. We also look at the digestive tract. Very important, especially when it comes to inflammation. You have to understand the digestive tract. Hippocrates said, look well to the digestive tract or the gut for the cause of all disease. And in a thyroid patient, at least what we see, it plays a role of about 20%.
And this whole gut health thing, the alternative gastroenterology and things like that, because we've talked on the phone. I mean, this is a topic where we could spend a long time on. But
Correct.
you like, and I'm going to quote you guys, heal the gut.
Yes.
You like to heal this intestinal tract. Do I have that right?
Right. And there's everything that goes through
because that could affect the thyroid.
Absolutely. In fact, It's one of the huge triggers. So what happens is there's toxins, there's bacteria, there's things going on intestinally that are antagonistic to your system. So it weakens you. Our goal is to get your body prepared for the fight to suppress the autoimmune response. And when those bad things are penetrating past the intestines and your body starts attacking it, remember, it sees it as an insult. So the antibodies are made. So again, that's an immune flare-up. So we have to knock down those immune flare-ups to get anywhere with the thyroid condition.
Okay, so, and if people are just tuning in, we're talking about hypothyroidism,
yes,
low thyroid, and you guys have a Chicago thyroid program.
Yes.
And you're seeing results. I mean, reversals in symptoms.
Every day.
Every day? Every week?
Every day.
Is that right?
Yes.
And one of your founders, I said, what do you want to be known for? And he said, results.
Exactly. Absolutely. That's what we want to look at. And when we do these tests and we look at these lab works, not just the TSH level, but there's a point in the patient's care where we repeat the lab work and we show them and we see the results. So that's what drives us.
Well, things get better.
Yeah, the happiest day of our life is when we get the post-lab work back a few months down the road and everything's cleared up and the patient's lives are totally different.
Interesting.
It's amazing.
Okay, so back to, you're doing nutrient, you check their vitamin status. Is that the way to say it? I mean, you want to see if they're getting, be vitamins absorbing?
Absolutely, but
amino acids.
Right. The reality is we're going to take a look at the blood work. We're going to look at the gut specifically. We're going to look at the cascade of hormone events in the body because that's a large trigger in about 50% of the cases that we see. And then we get into targeted nutrition. We get into customized and tailored treatment plans. It's not, again, just...
So they come in there weekly, is that right?
They do. A
couple times a week?
So, exactly. They start off twice a week. They get tapered off. Again, the clinicians are going to spend appropriate time looking at the blood testing, looking at the hormone cascade. They're looking at what's going on nutritionally. Sometimes there's food diaries and things like that that the clinicians work with.
You do food allergy testing as well?
We do. Remember, the things that leak through the gut that trigger that autoimmune response is bad for the thyroid patient. First and foremost, identify the triggers, Randy. Then after identifying them, we want to suppress it. We want to get those triggers down. We want to eliminate the triggers, and then we just support the thyroid gland. That's the beauty in it.
Okay, and we're going to take a quick break, but one of the things you said in the green room, you said that they come to us for thyroid. Yes. Okay, cold hands, cold feet, can't lose weight the way they used to. But once they get involved in the program, it turns out that they've got a lot of other problems. IBS, they have depression, anxiety.
Correct.
And those things seem to go away too when they start getting healthier?
They do, absolutely. So in the lifestyle changes, I mean, again, look at a person who doesn't have a life, who doesn't have depression anymore, who's not irritable anymore. Think about just sleeping through the night, Randy, so that they feel energetic in the morning. That doesn't happen when the thyroid's not working properly.
Now, we are out of time, but what do you say to the person? I'm very skeptical,
Sure.
too, because it sounds, sometimes too good to be true, but
Right.
somebody watching this, they're on thyroid medication, they feel lousy, they can't lose weight the way they used to, they still have, cold hands and feet or whatever, okay?
Right.
What do you say to them that maybe they've never heard this message about the Hashimoto connection?
Well,
What do you say?
I'd say
And they're
Google.
skeptical too.
I'd say Google it and find out. It's all in the common literature, and these are things that are absolutely affecting their bodies. So you have nothing to lose to come in and find out. But in reality, you have a lot to gain. I mean, these are patients that get their lives back every single day in the program, and we enjoy working with them because we see those results.
All right, okay, we're going to take a quick break. We'll come back more about the process. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you have a low thyroid, a loved one, low thyroid, hypothyroidism, you have to hear this next segment. We'll be right back. You are watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're talking about low thyroid today, what you need to know, and specifically, very interesting program. We have, Dr. Hinley here from Chicago's thyroid program, and he's saying it's targeted toward people that are taking thyroid medication, but still tired, cold hands and feet, constipation, mood swings.
Weight gain,
so give us a
fatigue.
recap, though, of these symptoms,
Well,
because we are just about out of time.
Yeah, these are the patients that, again, they're fatigued. They've gained a lot of weight in the last few months to about a year. These are patients that struggle with digestive problems. So they're not digesting properly.
That's
the
why the
acid in the
constipation.
stomach, constipation, right? Irritability, depression, muscle aches, joint pain. These are patients that, they have even headaches in the morning. They subside, but they come back the next day. They're headache patients. These are patients that see physical things in their body that absolutely are the signs that they need to be tested. And that would be coarse hair, hair loss, the skin loses its texture. These are all things that will show up pretty quickly when your thyroid gland's not working properly.
Now, I know on your website you guys have testimonials. You have patients that have actually, said great things about you guys. And so things like insomnia, brain fog, these things go away.
These are big ones. Yes, exactly.
Their weight gets under control.
These patients can't work out and lose weight.
Sounds like everybody needs thyroid, by the way.
Well, yeah, I mean, when you're not breaking a sweat and you're working out really hard, you're not going to lose weight. And this is a thyroid problem.
I guess you do more than just thyroid, but today we're talking about thyroid.
Right.
Tell me a little bit about your practice.
Well, the Chicago program really specializes in three things only. Our primary focus is type 2 diabetes. We also look at peripheral neuropathies, and then hypothyroidism, of course. So these are solely what the clinicians, and we have physicians of all different backgrounds that work there. And we work to...
So you have a medical doctor there and...
Correct.
Kind of a team.
Allied health professionals, yeah, we have a lot of people there, correct.
So you've been in and around, we've talked around prevention, longevity, health for about 22 years.
Exactly. 22 years, we've taken care of everybody from infants to world-class and professional athletes all the way up to, patients that are also struggling with their health with obviously these three issues as well.
So now your center, though, is in Chicago. We're in Chicago.
Yes, Oak Brook. So it's by a large shopping mall, well-known shopping mall.
Well, okay. Now let's begin though with thyroid. Okay. Who's the typical patient that comes in for thyroid on your thyroid program?
A typical thyroid patient is somebody who's frustrated. They've been diagnosed for many years prior. They've had their lab work. They understand what their readings are, and a lot of these patients have lab work that's actually within normal limits. The frustrating component for them though is that they don't feel normal at all. These are patients that have symptoms that are literally ruining their lives. Most of our patients with thyroid conditions are between age 30 and 55. These are young mothers. They have families to take care of. They have spouses that they need to interact with. And the problem is they feel terrible. They feel miserable.
Now, so I get this correct or right, that you don't give thyroid. These are for people that have already been diagnosed with a thyroid problem, but their thyroid medication is not working.
They're already on thyroid medication.
Do I have that right?
Well, the thyroid medication makes up for what the thyroid gland doesn't produce by itself.
Okay.
So the thyroid, produces two thyroid hormones, T3 and T4, and those are necessary for metabolism and a lot of things that are extremely important to the body to function. So these are patients that are on that already, but unfortunately they have symptoms that continue to get worse, and that's the frustrating part.
Okay, let's start there. What what are symptoms of low thyroid?
Well, fatigue and weight gain. So, weight gain, these are patients that don't improve or take more calories in per day, and they just continue to get larger.
Just can't lose weight the way they used to?
Right. They can't break a sweat when they're working out. They're gaining usually 20 to 30 pounds in 6 months or so. That should be a red flag that something's going on with the thyroid gland.
Okay.
We also have fatigue problems. These are young women, typically with young families, children, and they don't have time or energy to shop. They don't have time to prepare meals, let alone work out, even if they had the energy.
So they're just exhausted all the time? Is that what they tell you? I mean, when they come into the center, they just say, I'm just tired.
They do. And some of them are executives that can't work anymore. They're losing their job. There's guilt related to them not really being able to perform at work. And it's a huge issue for the entire family when the thyroid's not working.
Fatigue and weight gain. And let's talk, okay, so the thyroid, I guess, is in your neck.
Front of the neck, right? 2 lobes. And that gland is responsible for energy production. It also
and body temperature, right?
Right. It regulates body temperature. So these are patients that get cold in a room when the temperature in the room is, comfortable for everybody else in the room. So
now, okay, so people have like cold hands, cold feet.
They do. Circulation problems are part of it.
Thyroid?
Can't sleep well.
Do you go around diagnosing all your friends and family low thyroid?
I do. Actually, I have family members that have that going on. Right. And that's one of the things that prompted, and there are patients in the Chicago program. I have family members that are patients.
Interesting.
Amazing results, too.
So they come in there weekly. Is that right?
They do. A
couple times a week?
So, exactly. They start off twice a week. They get tapered off. Again, the clinicians are going to spend appropriate time looking at the blood testing, looking at the hormone cascade. They're looking at what's going on nutritionally. Sometimes there's food diaries and things like that. I
know on your website you guys have testimonials. You have patients that have actually said great things about you guys, and so things like insomnia, brain fog, these things go away.
Those are big ones. Yes, exactly.
Their weight gets under control.
These patients can't work out and lose weight.
Sounds like everybody needs thyroid, by the way.
Well, yeah, I mean, when you're not breaking a sweat and you're working out really hard, you're not going to lose weight, and this is a thyroid problem.
Is that right? Yeah. Okay, well, interesting. Okay, well, you know what? Final message. Somebody watching this, they're taking thyroid, like you say, but they still have these symptoms. Yeah. What's their first move? What do you suggest?
Really just come in and get checked. So, make
free consultation.
Absolutely. Make a phone call, talk to our staff, come in, families invited as well. Let us teach you more about the process. And again, you really have nothing to lose.
Okay, great. Well, thank you for coming on the show.
Thanks, Randy. It's
great info. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again or direct a friend to it, we'll give it to you. I'm sure you could have it on your website. We'll have it on our website at wellnesshour.com. Just put in low thyroid, or you could put in Dr. Hinley. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.